So what can I do for you today?
Hi, thanks for fitting me in. I have been getting these migraines for about 6 months now, and honestly, they have been getting a lot worse recently. I wanted to finally come in and talk to someone about it.
I am glad you came in. 6 months is a while to be dealing with that. Can you tell me a bit more about what they are like? How often are they happening?
At first, it was maybe once or twice a month, which I could manage. But for the last 2 months or so, it has been more like once or twice a week, sometimes even more.
That is quite a significant increase. And when a migraine comes on, how would you describe the pain itself?
It is always on one side of my head, usually the right. It is a really intense throbbing pain, like a pulsing, and it just builds and builds. At its worst, I genuinely cannot function.
Does the pain come on gradually or does it hit you suddenly?
It usually builds over about an hour. Sometimes I get a kind of warning beforehand. I start seeing these flickering lights at the edge of my vision. Then I know one is coming.
That visual disturbance you are describing is called an aura. It is actually quite a classic migraine pattern. Do you also get any nausea when they happen?
Yes, almost always. And I become really sensitive to light and sound. I basically have to go and lie down in a dark, quiet room and wait it out. It usually lasts anywhere from 4 to 8 hours.
Have you noticed anything that tends to trigger them? Certain foods, stress, changes in your sleep.
Stress is definitely a big one. I have a pretty demanding job, and I have noticed they are much worse during busy periods. I also think red wine is a trigger for me. I have stopped drinking it, and that seems to have helped a little. And if I do not sleep enough, I almost always get one the next day.
Those are all very common triggers. What have you been taking for them when they come on?
Just over the counter painkillers, ibuprofen mostly. They take the edge off slightly, but they do not really touch the pain if it is a bad one. I feel like I am just waiting it out rather than treating it.
That makes sense. Standard painkillers are not really designed for migraines. They work on general pain, but not on the specific mechanism that causes a migraine. There is a class of medication called triptans that are specifically designed for migraines, and they work much better for most people. I would like to prescribe you something to try.
I had no idea that existed. Is it something I take every day or only when I feel one starting?
You take it at the onset, as soon as you feel the migraine starting, or even during the aura if you get one. The earlier you take it, the better it works. It is not a daily medication.
That sounds much more manageable. Should I be worried that they are happening this frequently? Is there something more serious that could be causing this?
It is always sensible to ask that question. Based on what you have described, the pattern, the one-sided throbbing, the aura, the triggers, this is very consistent with a straightforward migraine disorder. But because the frequency has increased significantly, I do want to rule out anything else. I am going to refer you to a neurologist just to be thorough.
Okay, that is a bit nerve-wracking to hear, but I understand.
I want to be clear. I am not referring you because I am worried. It is a standard practice when migraines become this frequent. The neurologist can also offer additional treatment options if the triptans do not give you enough relief.
That is reassuring, thank you. Is there anything I can do in the meantime to help manage them?
A few things. I would really encourage you to keep a migraine diary. Write down when each one happens, how long it lasts, how severe it is, and what you were doing or eating in the hours before. That information will be very useful for the neurologist. And try to keep your sleep as consistent as possible. Going to bed and waking up at the same time every day makes a real difference for a lot of migraine sufferers.
I can definitely do that. I will start tonight. How long will it take to get the neurologist appointment?
It varies, but typically a few weeks. In the meantime, try the prescription I am giving you and keep that diary. Come back and see me in a month and we can review how you are getting on.
Perfect. Thank you so much. I feel a lot better just having talked this through.
Of course, I hope the medication makes a difference. Take care.